Hello, I'm Sophie Scott. Welcome to Healthwatch. Thousands of people use alternative medicine to help alleviate chronic health conditions, but are they wasting their money? A new report has found that supplements like fish oil and St John's wort are not only medically effective, but cost effective too. Australians spend $1.3 billion a year on complementary medicines such as vitamins, supplements and acupuncture. In a study for the National Institute of Complementary Medicine, Access Economics has looked at some of the cost-effectiveness of some popular treatments.
Well, we studied five interventions that had a fair bit of evidence around their effectiveness and safety, and we found that 4 out of the 5 were either cost-effective or cost-saving.
They found acupuncture for low back pain, along with standard care, was cost-effective. Giving St John's wort for mild to moderate depression instead of an antidepressant could save patients more than $140 a year.
And because there are about 340,000 Australians who have treated mild and moderate depression in 2009, we can estimate from that there would be in the order of $50 million worth of savings for St John's wort.
A combination medicine for osteoarthritis was as effective and cheaper than usual anti-inflammatory drugs. Fish oil was cost-effective for heart disease, but not for rheumatoid arthritis.
How's your knee getting on?
The knee is great, Jen.
76-year-old Bill Lawton was facing a knee replacement, but instead turned to treatments such as fish oil and glucosamine.
I feel, if I can use the phrase on top of the world, I feel in good health, I feel strong physically and emotionally.
But he says the supplements are costly.
I value this complementary medicine so highly, I try to give it priority. But I can't add more to it because I can't afford it.
Advocates want to see the most cost-effective treatments such as fish oil added to the pharmaceutical benefits scheme. For Bill Lawton, he says it's money well spent. The catchphrase, "Is there a doctor in the house?" could one day be obsolete as nurse practitioners take on bigger roles in healthcare. Demand for their services is growing rapidly along with their expertise, and with doctors in short supply, particularly in rural areas, nurse practitioners are stepping in to provide critical care.
The Flying Doctor Service has been the mantle of safety for Australia's outback since 1928, and these international nurse practitioners are getting a first-hand look. They're health crusaders, leading a growing push across the world, working without doctors to treat patients.
The patients have only one person instead of 2 persons doing the whole job. Medicine and nursing together.
Nurse practitioners have the authority to examine and prescribe medication for their patients, and they're injecting new blood into areas of critical need.
In Taiwanese, because there are shortage of physicians and house staff, and the nurse practitioner taking this gap.
I believe that we're going to become more and more demanded by the consumer because of what we have to offer.
In Australia, there are more than 400 registered nurse practitioners. From the 1st of November, they'll be granted prescribing rights under the Pharmaceutical Benefit Scheme, a move which some doctor groups have warned will compromise care.
There are some people that are cautious about what this means for healthcare delivery. Of course, we're totally committed and absolutely believe that this is a good thing for Australia.
Both groups agree, though, more health workers are better for the patient.
And one of Australia's best-selling painkillers has been shown to significantly increase the risk of stroke in otherwise healthy people. Commonly sold as Voltaren, the drug is called diclofenac. The manufacturers say it's safe if taken properly, but doctors suggest taking paracetamol first instead of anti-inflammatories. That's all for Healthwatch. See you next week.